Basin PBS is proud to partner with Midland Health to bring you the live Midland Wellness Tour Town Hall. Hear from local physicians sharing expert advice, practical wellness tips, and answers to questions from our community.
According to the National Institute of Health, although life expectancy and survival rates in the United States have improved dramatically over the past century, Americans live shorter lives and experience more injuries and illnesses than people in other high-income countries. Why is that? And what can we do about it? Back in 2014, Midland Health created the Wellness Tour that promotes health and wellness in Midland and encourages healthy behaviors, health awareness, and wellness activities at locations across the city. Where the wellness journey is a custom approach for every individual, the Wellness Tour is here to help provide a glimpse of wellness opportunities that Midland offers for our community. I'm John Mesh, Basin PBS board member, and tonight we're coming to you live from the Basin PBS Anwar Family Studio, where we'll hear from the experts on warning signs, small changes that can have a big impact, and what you can do today to start your wellness journey. Basin PBS is proud to partner with Midland Health to help educate our community on not only being active, but staying healthy. So please help me welcome our panel tonight. Dr. Patrick Nager, orthopedic surgeon. Dr. Stephanie Caples, Vice President of Behavioral Health for Midland Health and Medical Center Health Systems. Dr. Madhavi Gadaraju, Obesity, Lifestyle Medicine, and Internal Medicine physician. Dr. Ramnafali Kadragada, Pulmonary and Critical Care physician. And Dr. Saleh Patel, Interventional Cardiologist. Thank you very much, everyone, for coming tonight. We got a lot of ground to cover. It's going to be a great conversation. But first of all, thank you for what you do for our community, and we can't say that enough. And thank you for spending time with us tonight. Before we get into our first question, Dr. G, I noticed lifestyle medicine is something that is behind your name, and that's a term that we hear a lot, but I don't know that a lot of people have a really firm grasp about what that exactly means. Could you explain that?
Well, thanks for having us, John. Lifestyle medicine is, in simple language, it's just a type of healthcare medicine where we encourage our patients to have healthy lifestyle choices on an everyday basis to just prevent, treat, and also maybe reverse chronic diseases like diabetes, high blood pressure, obesity, heart disease, fatty liver, and many more. So we basically focus on 6 pillars, eating healthy, regular physical activity, managing stress, having adequate sleep, and being socially connected in general.
Really, so it's just treating the whole lifestyle of the person.
On a daily basis.
Well, that leads us in our first topic, prevention versus treatment, preventative versus reactive treatments and patient outcomes. So what are some of the biggest health problems you see that could have been prevented if caught earlier? Dr. G?
Well, every day, I'm sure all the doctors agree with me, so every patient, almost every patient on a daily basis that we see with chronic medical conditions, be it like diabetes again, high blood pressure, heart disease, stroke, fatty liver, cancers, lung diseases, can all be prevented if only they were screened appropriately, because all of these conditions can be identified with routine screening and just addressed with simple interventions. So at the end of the day, as providers, we want to help patients understand the risk not only in today's life, but going further, what all these conditions can complicate into, and just help them, participate or, start doing preventive measures and maybe prevent and treat if they already have the disease. So if you're asking which is better, prevention versus treatment, both mostly go hand in hand. Well, if you want to say, hey, I'm only going to do prevention, well, the patients who already have their medical conditions, it's like we are not caring for them. Mm-hmm. So, but again, if you're only going to wait until the patient develops diabetes or heart disease and then treat them, that's too late too. So they go hand in hand. You want to do prevention, you ask me from day one in your life. For all age groups, you want to do prevention. And again, sometimes prevention alone is not good enough, so you detect the conditions early, so you treat them efficiently, so at least you're preventing complications from those diseases. For example, treat diabetes efficiently, maybe healthy lifestyle changes, and so that you're not, you're preventing like diabetic retinopathy or kidney failure or heart disease from diabetes.
Dr. Cables?
Yes. I agree with everything you said. Mental health tends to play along the same lines. A lot of people think mental health is different than physical health, but a majority of mental health symptoms that go along with diagnosable mental health conditions are physical in nature. So there's a very big overlap between mental and physical symptoms. But one of the things about prevention, if you look at the prevalence rates, which is how many people are having depression and anxiety in our country, versus the genetic predisposition, which means you might just develop it based on your genes, right? So you look at those, our prevalence rates in our country are a lot higher than what we know to be genetic predispositions, which says a majority of this can be preventable. If it's not, we can absolutely manage it to keep the severity within a reasonable condition. Another thing about mental health conditions is the majority of the time, most people with a diagnosable condition like depression, it's an episodic condition. An episodic, just like a TV episode, it comes and goes. So what that means is we can get your symptoms into remission where you're asymptomatic. You're not feeling a lot of the symptoms of depression.
So those episodes don't happen as
So they
often.
don't happen as often, as frequently, or they don't get as severe. It's just like, when you get the flu and they say you got to take Tamiflu within 48 hours for it to be effective. Well, the earlier you come for your treatment, the better we can treat you and the faster that we can get you into a symptom management or remission. And so when you look at the realm of prevention can mean a lot of different things. A lot of times with lifestyle choices, we can make it to where you might experience an up and down or some stress, but it won't turn into the diagnostic episode, right? But so we can prevent the severity or we can prevent the onset. But in the case that it is a genetic predisposition that you develop it, we can manage it. And so you can still go on to lead a very healthy life.
Wonderful.
Yeah.
Dr. Patel?
I agree completely with what's been said so far. I think heart disease especially is a little bit, in some ways, the end result of the lack of prevention of some of these other conditions that a lot of patients have, like high blood pressure, diabetes, high cholesterol. And I kind of think of it as having a problem with your car. If you catch something like a small leak somewhere, sometimes it can be patched up and you don't have to have any further work done on it. But if you wait till the car doesn't start up, you're going to end up paying a lot more in the long run.
Dr. Katragata?
So I know all of them have talked about preventing heart diseases, general health conditions with lifestyle management, right? Like physical activity, eating healthy and stuff. The other important aspect which we can focus on is with prevention is our social factors. Like, what are your choices in life? What are you choosing to do as a social activity? So in the pulmonology world, the biggest burden we have right now is COPD, which is also interchangeably called like emphysema, chronic bronchitis, and lung cancer. Earlier, colon cancer, breast cancer were the leading causes of deaths in the United States. In the current year, all cancer deaths combined from breast cancer, colon cancer, and prostate cancer is equal to the deaths that lung cancer causes. So it's a highest burden. And how can we prevent it? By, working on our social habits. Smoking is a biggest thing. Someone who smoked in life has 7 times higher rate of getting COPD. And someone who smoked also has higher prevalence of lung cancer. 80% of lung cancers are associated with smoking. So, I would like to put forward this one and stress on the smoking in this particular question that, that's the biggest thing in pulmonology world which can prevent cancers and COPD and help with preventing a lot of morbidity and mortality associated with these conditions.
And wouldn't you say, though, when someone, for example, decides to quit smoking, which we hope they do, right? If it's been a few years, that doesn't mean just because you quit smoking a few years that that you don't need to be screened anymore. You don't need to be, followed up.
Right. Absolutely not. That's the biggest myth a lot of people have. Now, nobody picks up a cigarette thinking they're going to be smoking for 30 years of your life, right? And when you make that decision, that's the best thing to prevent COPD or cancer. when you quit smoking, it takes about 10 years for your risk of cancer to reduce to 50%. And it takes about 20 years to be equal to someone who's not smoked. And I think Dr. Patel would agree, it takes 15 years for your cardiovascular risks to be equal to someone who's not smoked. Wow. So quitting smoking 5 years, 10 years does not take away, it decreases your risk for those conditions, but it doesn't take away the risk completely. So you still have to be screened until your risk completely goes away.
The sooner the better.
Yep. Never late to
Right.
quit smoking.
Right. Dr. Nager, from an orthopedic standpoint, prevention versus treatment, talk about that.
Yeah, so a lot of lifestyle plays a part in orthopedics, of course. A lot of muscular injuries can actually be prevented in orthopedics. The rotator cuff's a really good example. So good warm-up, make sure you're maintaining your flexibility and your mobility, proper lifting techniques, taking care of the smaller muscles around your shoulder so the rotator cuff doesn't have to work as hard. You can avoid a rotator cuff injury before it's even a problem. So that's a really good example of how lifestyle choices play effect in orthopedics.
Yeah, and I noticed, I spent some time in physical therapy recently, and I noticed, well, there's a lot of knee injuries.
There's a lot of knee injuries.
A lot of knee injuries.
A lot of shoulders with the pickleball now, a lot of hips, and the physical therapists are great, man. So.
Well, yeah, they really are. But when it comes to, watching over your knees, can you give us some tips about, preventing knee injuries? I mean, sometimes they just happen, sports injuries, things like that, but what can we do?
Yeah, great question, John. So there's a lot we can do, actually. So a lot of little things, too, make a big difference. One of them is you got to stay conditioned, okay? So keep the muscles strong around the joint, okay? That means less force going through the joint, less pain from the arthritis. Stay mobile, stay flexible. Once that joint gets stiff, you can have a real problem because the joint gets stiff, you become less active, you get more stiff, you're less active. That's a tough cycle to break out of, okay? Weight is a huge part in knee health. Every pound you have, every pound you lose, I should say, makes the knees feel a lot better, okay? So the weight loss is good for the knees. Taking care of the muscles around the knee, the flexibility, all of that really plays an important part in knee health.
I don't think people realize how much when they lose 10, 15, 20 pounds, how much pressure they've now taken off of their knees and their joints.
Exactly. It makes a huge difference.
Yeah.
Well, warning signs that people ignore, and you all see that. What symptoms do people commonly brush off that they should actually prompt a conversation with a healthcare provider? And that happens quite a bit. They kind of know something's going on, but maybe I hesitate to find out what it might be because it might be something I don't want. But Dr. Patel, what are some of the warning signs that you typically see people ignore?
I think the biggest one in cardiology is shortness of breath. A lot of folks, as they get older, they just attributed the shortness of breath to getting older. I'm slowing down, I can't do as much as I used to. But that really is a change. And especially in someone who's been active all their life, if they're noticing that they can't do the things that they used to be able to do, that's a reason to get checked out and think about the heart for sure.
Right, right. Dr. Cables?
All of them. Mental health can be challenging, and there's a lot of symptoms that we feel that we may not attribute to a mental health condition that we ignore, right? Stress, mood swings, I'm just in a bad mood today, or my kids are frustrating me, and so that's why my mood is up and down, or maybe that's just my story, I don't know. But, we have a lot of it, or fatigue. Fatigue is a really big one. A lot of people don't realize that fatigue is rampant in depression. And it's one of the major key risk factors of developing a more severe depressive episode is fatigue. So there are a lot of symptoms, a good majority of them, that for different reasons people ignore or keep silent or internalize when it comes to mental health. A lot of people think, well, I'm not sad, or I'm not in this psychotic episode, so I must be okay and I must be fine. They don't realize a restricted appetite or maybe even overeating is a sign of mental health conditions. So many of our conditions in mental health really mimic lifestyle choices, and it's hard to change what you eat and how you eat, or to get up and move, or to sleep better. If you can't sleep, I think we all just say, well, I'm too busy. My mind is just going, like, that's just how I've lived the last 20 years. And those things in a range over a prolonged period of time are just not normal. So we often tell people, or at least I do, is if your daily functioning is impacted for about 10 to 14 days, then come to me, come to a doctor, go to your church, your pastor, your primary care doctor, and get a proper assessment and let us tell you what's going on and help you through that.
I think it's interesting that, at least my observation is that younger people, when it comes to warning signs about their mental health, because they have been challenged so much in the last several years, it's interesting that they almost have arrived in a space where they can more comfortably talk about warning signs of mental health than their parents and their grandparents.
Right. That is absolutely true. And in a way, that's a great, great thing, because there is an expression that happens with the younger kids where they are able to own where they are and almost advocate for themselves. There's a double-edged sword, though, because then they go to ChatGPT and TikTok and get the answers to
Right.
what is fixing this and their peers. And sometimes that leads to great resources, or it leads to help and aid in how do I talk about this with my parent, or how do I talk about this with my teacher. But sometimes it's the opposite, because then you can't control the influences that they're getting to say what should really this feel like, what should this be like. So it's kind of this balance that we have to play. But I think the biggest thing, the most positive thing about the awareness now is that they will speak on it. Other kids will speak on it too for them. You know, I've had some of my kids' friends come to me and say, hey, I'm worried about my friend, because they know what I do, right? And they can't necessarily articulate what exactly is going on, but they can tell me what they said, and they know enough to be concerned. Yeah. And so I think that is an absolute great thing.
And even at the workplace too, I think if just paying attention, just paying attention to your coworkers, and you observe something, say something, or have a conversation, or encourage them to have a conversation. It's
so easy to say, Dr. G is in a bad mood, I'm avoiding her. She must be having problems with those 2 kids she told me about, It's very easy for us to ignore each other, but you're absolutely right, John. We're now getting the message out that if your coworker, if your friend, if something is going on, you don't have to say, I think you need to go to a shrink. You can just say, are you okay? But when you ask that question, are you okay, make sure you have time and space to listen, just in case they start emoting.
Right, because they'll tell you.
Right.
Right.
Sometimes they'll tell you, and we call it emoting, and that's a good thing. But don't just give them the space, listen to what they say. You don't have to have the right, perfect thing to say back. You don't have to say, I know what that feels like, if you don't.
Just holding the space.
Just hold the space for them and say, I get it, I understand, I hear what you're saying, I'm sorry. Yeah.
And we see that a lot in primary care, like as providers, primary care providers, we have the advantage of knowing our patients through years. So once a patient comes to us, which I see a lot actually, they're not themselves, they're not them. So I ask them what's going on, they're really reluctant to share. So I just give them, based on how bad or good their mood is, give them a few minutes, and I just go and put my hand on their knee. They break down.
That's right.
They don't even realize they have depression. They break down, and a lot of times if there's something different, I ask, hey, how is your relationship with your kids and your husband? And they say something is going on. So sometimes the patients don't realize, but the family realizes something is going on. So yeah, we see that a lot in primary care.
Oh, wow. Dr. Kadragala, how about you?
So when we're talking about,
Warning signs.
Yeah, the warning signs, right?
Yeah.
So I would stress on weight loss, okay? Most of the people are happy. Okay, I lost 10 pounds, I lost 20 pounds, yay. I feel better, I feel good about myself. But if that's intentional, if you're trying to lose weight, you're making changes to lose that weight, that's a good thing. But if that's unintentional, you're losing weight without doing anything, that means there's something else going on with your body.
Right.
So I would reach out to your primary care or whichever your family doctor, whoever you're seeing, to get checked. It could be as simple as you could have anemia, you could have endocrine issues, you could have diabetes, you could have malignancy, cancers. So we don't know. It's a wide range of things that can cause weight loss. So that's something, if you're not intending to lose weight and you lose weight, you have to reach out to your doctor.
Right. Dr. Nager, warning signs?
Yeah, so orthopedics is very different, but I think one thing that's very similar to what you guys were talking about is the symptoms that are persistent. So a red flag in orthopedics is symptoms that really don't go away. Pain that gets worse or just lingers for weeks and weeks. Orthopedic specifically, if you have joints that are unstable, your knee feels like it's giving out, your shoulder feels like it's slipping, that probably warrants a doctor's visit. If you can't bear weight, that probably is a red flag. You need to go see a doctor. So symptoms that are persistent or getting worse, that's probably a sign you need to go see somebody.
Well, and in this area of the country we live, we have a lot of ex-athletes.
Oh yeah.
Who don't want that they want to push through injuries sometimes and not admit, no, I'm just fine, right? And that's not a good thing.
That's not a good thing, and that's almost the art of medicine. What is, normal post-workout soreness? What is, just getting older? What is ache? Versus what's injured? When am I hurt? And I think if, that's a good gray area that a doctor can really help you out and navigate.
And I would like to add something. We don't want to just restrict to symptoms. I would say, hey, there are signs, there are warning signs also, because a lot of this health condition, being cardiac, pulmonary, diabetes, fatty liver, they are I would like to say they whisper before they scream. Mm-hmm. So, when you do routine follow-ups with your doctor and you say, hey, your A1C is a little high, but it's just in the pre-diabetic, don't worry about it. Or your blood pressure is a little high, but you're fine. So don't do that, either the providers or the patient, because sometimes 5 years later, the patient comes to me with A1C in the 15s, already having kidney issues from that. So those are all warning signs, like borderline abnormal blood work. So make sure, I would always tell my patients, hey, if you don't do so-and-so, it's just going to be diabetes and you have to be on medication. Or if you don't watch your kidneys, you're going to go into kidney failure. Right. Or fatty liver, everyone. Most of them in Midland have fatty liver, and they think it's okay. It's not. Actually, fatty liver is a precursor for heart disease, a heart attack. So those are small warning signs that have to be addressed and taken seriously not only by the provider but also patients, and not wait until they get worse.
Well, and I think AI, unfortunately, does not do any of you a favor, because when someone experiences warning signs, there's now something in between you that's going to potentially say, well, or minimize those warning signs, depending on what they put in there, which will, again, give them this idea that, well, I'm okay, I'll just push it down a little bit further.
AI does warn you, though. It
What's
says
that?
this is not
Sometimes.
medical opinion.
That's right. AI is not a doctor, okay?
But
Right.
one point I think that is really important is it's really about their perspective, right? So when you were speaking about some of the orthopedic, in our athletes, some of our athletes if you're kind of in my age group, the no pain, no gain, right?
Exactly.
Which tells me that there's still stigma associated with going from any kind of medical care. There's obviously still stigma associated with mental health, but other medical care, just even because I remember when I was doing clinical practice, and a young lady, she was very young, she was in her late 20s, had been diagnosed with hypertension and did not want to take her medications and told me this very freely, I don't think I need to. Wow. And I said, well, I think it's really important for you to do that. And she said, nope, that means something's wrong with me, right? Now, she didn't mind coming to therapy, but she did not want to be diagnosed with hypertension, right? And she did not want to take the medicine because this is a chronic condition and that means something is wrong with me for a long time. Fast forward a couple of months, she comes into my office and she just did not look like herself. And I said, you don't look like you feel good physically, something's off. She was in hypertensive crisis in that moment in the office because of the stigma that if I go in and I do have diabetes, something's wrong with me. Yeah. Right? So we're all, in every aspect of medicine, I think we're all still working to change that stigma and advocate and let people advocate for themselves that something is just not right.
Yeah, something's off.
Yeah, and that's okay.
Dr. Nager, what really happens to our bodies? Let's talk about inactivity, because that's a big topic. The impact of inactivity, just simply not moving, has its risks and its effects, correct?
It does, yes, sir. So it does have its risk, and it's bad. Inactivity is bad. And there's three main reasons why inactivity is really bad, okay? Number one is it leads to less muscles, okay? You lose your muscle, you lose your mobility, you lose your range of motion, and you feel that. You'll feel that in your daily activities. You start slowing down. You become weaker. Nobody wants that, okay? Number two, we talked about that cycle, the inactivity cycle, the joint stiffness. This can exacerbate arthritis. So your joints can really get stiff and make it harder to do stuff. And then, like Dr. G was saying, I'm going to steal this. I love that, okay? If you are inactive, you actually lose your bone density. Your bones themselves become weaker, okay? And this is one that whispers before it screams, okay? It's usually silent until something bad happens. And if your bones get weak enough, you can actually have fragility fractures, okay? We see this a lot in wrist fractures, spine fractures, hip fractures. The best way to prevent that actually is be active, okay? Staying mobile, low impact activities. Just a little bit of low impact can solve all three of those problems for you. The older we get, the more important being active is, because as you age, you're already going to lose a little bit of muscle and lose a little bit of bone regardless.
Yeah, you took it right off the page here. I was going to talk about elderly patients and how important it is to stay active, because you've probably seen the difference dramatically between someone who has continued to stay active throughout their life and someone who may have been active and then has slowed down, and they're more prone to injury.
That's exactly right. I could see two different 50-year-olds in the office, and you can immediately tell who's active and who's inactive. They look totally different, they feel different, and they have totally different pathologies.
Dr. Caples, does inactivity have a correlation with mental health?
Yeah, it really does, for a variety of different reasons. One of the ones that we talk about all the time is the dopamine release, right? That's the chemical in your brain that makes you feel better when you've done something. You've heard of the term runner's high. People that run kind of get addicted to that dopamine and then they work out. And so that chemical part is really, really important. But then there's some other components that are a little bit more silent, but just as important. When you're more active, you're going to feel more productive, and that's going to increase your motivation to continue to be active. Typically, when you're more active, you're interacting with other people socially. And so social interactions are a huge preventative factor in depression and anxiety, because you're feeling connected to other people. So activity is huge. But the thing about it is, when you don't feel good mentally, you don't feel like doing anything. We've all been in a bad mood,
Right.
or had a major stressor or a life event happen. And you don't. Some days you don't even want to take a shower. But even those things of getting up and taking a shower, you feel more productive, you feel clean. So whatever the activity is, and some people really can't. It's not a they don't want to, it's a can't.
Right.
And so taking those baby steps to get up and even go into a different room can be a very big win. And then we got to get you out of the house. And then we got to get you in the exercising and whatever. I don't even use that term anymore. I just say go take a walk, or,
Right.
10, 15 minutes. I call them little bite-sized things. And that's what I do to motivate myself, because I don't want to work out for an hour either. But if I can do it in 15, 20, 30 minutes, it helps me. But then the way that you feel afterwards, you feel accomplished. So that's the motivation for the next time of you doing it.
Awesome. Dr. Patel, there's a lot of, you see a lot of times as far as how much activity you need. Is it 15 minutes? Is it 30 minutes? Is it 3 times a week? Is it 5 times a week? What say you?
So the American Heart Association actually has guidelines on this, and the recommended amount of time is at least 150 minutes per week. And there's actually data to show that if you double that to 300 minutes per week, there's actually added benefit. So it's quite a bit of time that's required. But if you're not exercising at all, then it's most important just to start somewhere.
Right. Dr. K, you follow that? You agree?
Absolutely. That was one of my keynotes coming into this. The key is to start slow if you've not been doing anything, baby steps, and graded increase in your activity. I just love this term, deconditioning, right? I use it with my patients all the time. It's a medical term, but you can understand it. Basically, when you're inactive, you're deconditioning your body to do less. And then when that happens, like Dr. Nager was saying, it's not just the peripheral muscles in your body, your heart muscles, your lung muscles, your respiratory muscles, everything kind of weakens. And when you start to move in that condition, your heart and lungs are kind of working more for the same thing that they were easily able to do a few days back or a few months back when you were active. Mm-hmm. So you have to recondition your body to that spot, but yes, it's difficult. It's very difficult, like Dr. Capel was telling. Just start with 5 minutes, 10 minutes, move around in your house, walk around your neighborhood, and then baby steps and get to where we have to.
Dr. G, I'm glad there's been a spotlight on walking. Walking used to get a bad rap. It's like, oh, it doesn't do anything for you. But walking's kind of become the star here lately, huh?
Uh-huh.
Yeah.
Yes, walking, yes, it's good for cardio. I always tell my patients, because there's a lot of talk out there about, hey, my metabolism is low, I don't lose weight. But I try to explain to my patients, hey, your muscles are like powerhouses. You need to fuel them with healthy food and fire them. So if you're fueling, not firing, or the vice versa, it doesn't help. So both cardio and strength training, they're really important.
Excellent. Well, we're just getting started. We still got half a show left, so I'm excited about that. But we do need to take a short break, short Stetson break. So when we come back, we'll have more from Midland Health. Well, welcome back. We're coming back to you live from the Basin PBS studio, the Anwar Family Studio. And we're going to continue our conversation on health and wellness. We've just started scratching the surface, so thank you all. It's been wonderful so far. Well, let's move on to small changes. We were just talking about just getting started, but small changes and big impact. If someone wanted to improve their health just over the next 30 days, say, for example, what is one realistic change that you would all recommend? Dr. Patel, we'll start with you.
So I think we were talking about walking, and I think that's a great start. But I think the most important thing is to also make sure that you're slowly increasing the amount of time that you're walking and also the intensity of how you're doing it. When we think about the American Heart Association's guideline on exercise, they don't define not only the time, but also the intensity. And we think about moderate intensity exercise for a prolonged period of time when you're initially trying to get to optimal health. So you really should be exercising enough that you have a little bit of trouble completing a full sentence. You really have to get your heart rate up and get those muscles firing to have a good, long impact.
Just to encourage people to challenge themselves,
Absolutely.
not just leisurely walk all the time, right?
Exactly.
Dr. K, what's one small change you'd recommend?
More than it being like a health change, I would want to stress on being more socially active too. Okay, we're living in a world where we're more to ourselves, nuclear families, like just your spouse, your kids, your family. You're busy in your life's work, but I think just stepping out of that comfort zone, actually consciously making time for your extended family, your friends. It just helps in a lot of ways. Maybe it's an activity you're doing together with your family. That helps with health. It's a stress buster. You're venting out, or you're just sharing your day. You're sharing your life with the family. That helps your mental health. It helps your mood. So I think just socializing more, giving time, spending time for someone more than your nuclear family. I think that's very important.
One of the remnants of COVID, right? Because we all kind of fell into our own little our pockets, and we've now had to slowly kind of come out of that.
Exactly. Right? As pulmonary critical care, I didn't like COVID for many reasons, but I was glad during COVID we were some of the very few professions which still had that human connect. I saw in real time a lot of the professional people who were working from home, absolutely has not seen anybody else other than themselves, their own home, and that has affected them in a lot of ways, physical and mentally. But we were lucky in a way that we got out of the home every single day, went to the hospital, saw patients, talked to people. I think that's a good point you brought up, John.
Yeah. What's one change, Dr. G?
Well, I can't agree with more with being socially connected and walking. Actually, there's been a lot of research lately also how walking even like 20 minutes a day makes a huge difference with the chronic medical conditions. But I would also say maybe, just look into yourself and see what is that one small goal that you want to achieve. So be it, hey, losing weight, or is it you're stressed, your anxiety or depression are not controlled. So try to make that one step closer to that one goal you want to do. Be it like diet, physical activity, or meditation, or connecting with a friend or a family who you haven't talked to in many years. All of those small changes make a meaningful difference.
Because some folks, after a long time of, say, inactivity, or maybe inactivity socially, they sometimes think maybe it's too much. It's too daunting. So small bites, small steps could actually help ease them into that.
Yes.
Yeah. I know you've got something to say about this.
I have a lot to say about a lot of things.
Okay.
Sleep hygiene is a really big one. And some people think, well, I sleep. Well, sure, but if you sleep 12 hours a day, that's not okay either, right? And so most of us don't get enough sleep, or at least we feel like we don't get enough sleep. We're not rested. Even if you sleep 8 hours, how much quality sleep are you getting? Are you getting into the REM? Are you getting into the stages? I know I'm guilty of it. We stay up as long as we possibly can with all kind of stimulation going on, and then it's hard to fall asleep or stay asleep. And if other people are like me, as soon as your eyes pop open, you're thinking about everything that you have to do, right? So the quality of our sleep in general, I think, has been significantly diminished with advances in technology and lifestyle and all the things. And so really focusing on a really good sleep hygiene routine every night for yourself and your family and your kids, because if your kids don't have a good routine, you won't have a good
Right.
routine. Surprise, surprise. So I think that that's a big one that I would suggest.
What are a couple of things, 2 or 3 things that that you would recommend that people do to try to achieve better sleep at night?
Sure. Well, routine is one of them, right? Anytime we get into a routine, that's helpful because you know what to expect, your kids know what to expect. And routine simply means try to go to bed around the same time every night, right? And if you're one of those that likes to shower because it kind of calms you down, make sure you do that. One of the biggest indicators, though, is turn off anything that is stimulating. I do not do that.
I think all of us are guilty of that.
I know, I really am. But I think there's been a couple of times where I have, just to say, let me see what this does for my brain. It's not going to work. And then it works. My sleep is better that night. And so that's a really big one. But I think consistency is the key. There's a lot of recommendation about a very dark room, a cool room, right? A lower temperature, comfy beds, make sure it has the firmness in the pillows and all of the things that support your actual body. But I think the lack of stimulation and a cool, dark space that's quiet and that routine is the most essential.
Awesome.
Yeah.
Dr. Nager, what small change would you recommend for somebody that would make a big impact over the next 30 days?
Yeah, John, for orthopedics, I would say get active, okay? Especially low impact activities, motion is the lotion, okay? Whether it's walking like we talked about,
Right.
swimming, biking, light strength training, whatever your thing is, the best exercise is the exercise you do, okay? A little bit of consistency with the exercise and the activity goes a long way. So just be active, doesn't even really matter what you do.
I'd like to connect to what Dr. Nager said and what Dr. Capel said. Another important thing that would help in a better sleep hygiene is also exercise.
Yes,
Yep,
that's true.
Which is kind of contradictory. Okay, I'm like all pumped up, I went to the gym, but it's not that way. You have an active lifestyle, you do that activity, you can have a better sleep quality. So
Absolutely. That's awesome. Stress and physical health. Anyone? Dr. Cable's.
Why are you making eye contact?
I know, right? You know, we often think of stress as just a mental health issue, but how does stress affect the rest of the body? Dr. Patel, how does stress affect the body?
I think stress, aside from mental health, also has physical effects on the body as well. Even if you look at, for example, myself, I wore one of those glucose monitors, and I would notice that when I was doing a stressful procedure, my sugar would actually go up. So it was really interesting to see that. I think just having a little bit of stress in your life probably does affect your hormones and your blood pressure, your glucose regulation, your insulin sensitivity. And so controlling that stress and finding a good way to cope with it and to relax is really, really important.
Dr. G, you mentioned that you've seen some patients that are coming in to see you and that you've seen over time, and you can tell when they're experiencing stress.
Yes, for sure. I mean, and I also see a lot of patients who come to me for weight loss, and again, they are in stress, they have anxiety, depression, they don't realize. So when I ask them the questionnaire, I a lot of times diagnose them of anxiety, depression, or stress and try to handle or treat that before we go into stress. But one thing is, I always liked reading about this. So the difference between acute stress and chronic stress, I think Dr. Capels will able to explain that. Acute stress is good, like a dog chasing us, our heart rate, our blood pressure goes up, our blood sugars go up, our muscles need all of that to run. But as long as the threat is gone, everything goes back to normal. But now day and age, we are in a chronic stress, be it work, family, health. We are in a chronic stress, and that keeps our blood pressure high, inflammatory markers high, sugars high, that eventually cause heart disease, strokes, cancers, and if you would like to add
Well,
more
I have
to that.
nothing to add. You stole all my thunder. No, that was beautiful. That's exactly right. And that's where I was going to go is a bit of stress is normal, right? And we want to normalize the acute stress, right? There's a situation in your life. It's okay to acknowledge and own that this is a stressful event. Once it becomes chronic is when it's problematic. And that's when your symptom severity is going to be prolonged, which means it's going to feel worse. And you may respond very differently to maybe events that aren't maybe typically as stressful, right? So you'll notice that you'll have a larger response to that. And so that's what we need to do. We need to develop effective management skills. I tell people all the time, if you have a goal to never be stressed, first of all, give me the answer to that.
Right,
because
yeah.
I don't know how to do that if you figure it out. But that's not the goal. The goal is effective and efficient management of the stress. So your stress cycle should go like this, right? It shouldn't go like this or stay here. The majority of us kind of go up here and stay here, and we don't kind of have that natural reprieve of stress.
No, I would like to know that too, because a lot of our patients are in that state and they don't know what to do. And as a primary care provider, I don't know what to tell them too, you
Right.
know, I mean, because not all patients are willing to see a psychologist or psychiatrist. So I would like to know what to do on a daily basis to
Well-
help them recognize and to help them.
We could be here a whole month if I could tell you what to do, but I think this is where it becomes into individual differences, right, for your patient. And you sound like you very much know your patients really well. So I think identifying the source of the stress, but then narrowing it down to the primary stress or the thing that's the most stressful, and develop management techniques for that. Because the management technique for that might feel a little different than the management technique for something else. If you lost a spouse, you're going to manage that very differently than if your boss just gets on your nerves. Do you see what I mean? And so it's about particular stressful events and effectively managing those. But then we can have consistency in an overall lifestyle plan and things that we do to consistently manage, like what are we eating? Are we active? You know, are we enjoying family time and time with our friends? Or do we need to limit that? Do we need to have boundaries about how much family time we have? You know, so that is going to be on an individual basis, but I tell everybody bite-sized. Don't go making significant lifestyle changes. If it's not bite-sized that you can continue to do consistently for 3 weeks, that's not the right activity for you. So some people will tell me, I love cooking. That helps me manage my stress. Well, I'm not going to go cook because that stresses me out. So don't want to do that. Are you learning a lot about me? I have a horrible sleep pattern and I don't cook. But there's different things depending on your patient and what gives them joy. We all find joy and peace in things. Add that into your daily routine. You know, just a few minutes a day. We need to start small like we've been talking about, adding elements of joy, a few minutes a day consistently into our routine. And that sleep is huge. And hydration. We didn't mention hydration.
Do we have any online resources or AI tools?
Well, here we go down that path. There's a lot of great online resources and self-help. We would have to talk, and I could guide you in some good ones. Mayo Clinic has phenomenal resources on mental health.
You know, COVID has come up, of course, because it had, I think, it still has so many effects that we're still, you know, learning about. But when it comes to stress, I think that one thing we found out is that a lot of people didn't know how to manage stress.
Right.
Because they were thrown into situations where families, members maybe didn't know how to handle stress very well, and then they came out of that, and I think it really impacted young people the most. So you probably have seen the effects of that kind of stress over the last several years.
Absolutely. As we're talking about COVID, the biggest stressor was the isolation that people felt, which tells you that naturally we're social beings. We need to be out there and connect. Sometimes for your patients that you may not know how to manage, have them just talk to a trusted person that will allow them the space. People often say, why would I go to therapy? Talking is not going to help me. But what do a lot of us do when we're stressed out? We start venting.
Yep.
So you're telling me it doesn't work? Oh, yes, it does, right?
Yeah,
And so
yeah.
that can be a very easy, but you can't talk to everyone. You have to know who you can talk to, who's not going to start telling you what to do or giving you bad advice or whatever that is, so that can just hold that space for you. So connection can be a significant key for the majority of people, depending on life and lifestyle, and make sure they don't have any social conditions that prohibit that. But connection could be a really good key. They need a partner, an accountability partner to lose weight or to take their insulin or whatever it is. Yeah.
Dr. Nager, does stress have a orthopedic component potentially?
It does, actually, and this was very well said, and I was going to backtrack to something you guys mentioned about inflammatory markers and inflammation. So a lot of times when stress manifests itself in orthopedics, it's actually after an injury, and we see a lot of delayed healing and prolonged recovery that we don't see without stress. So it absolutely can have an effect.
Well, I noticed that, yeah, you're exactly right, 'cause I noticed that, when I had a bout with some tendonitis, and it actually affected the way some labs showed up.
Absolutely.
I had no idea.
Yeah, it can have physical manifestations.
Wow. Well, let's talk about screenings because that's well, we're lucky and we're fortunate in this day and age that there's so many screenings and the quality of them have dramatically improved. Has the ability of people to go have them improved at all? Are they using screenings more than they used to?
I think so. I think we definitely have access to a lot better screening and a lot more parameters that we can monitor. Touching to what Dr. G had said earlier about warning signs, there's all of these little parameters, blood pressure, cholesterol, blood glucose, all these things start to get a little bit abnormal, and they can go on for years and years and years before they really cause a major problem. So screening for these things is really important because that can promote early intervention. And a lot of times it's lifestyle changes. It's not even requiring medications. If you catch something early enough, it can be treated and it can prevent a lot of the downstream effects of those issues.
What are some screenings that adults should just not skip?
I think the biggest thing Dr. G would add on to that is lab work. Simple lab work every year. After a certain age, you're expected to get blood work. Okay, so the very definition of screening is you're not going to go get that blood work or that test or investigation when you start having symptoms. It's like even if you have no symptoms. Okay, I feel fine. Like, I don't need screening. I don't need to get a blood work. But screening itself means that you do something before you have a symptom, before you start showing those signs, so we can catch it early. So blood work is a major thing. But in a pulmonology field, obviously we're talking about cancer and stuff. The question that you asked, do we have access to the screening tools? I would say yes, compared to 10, 15 years ago, 20 years ago. A lot of areas, the screening has been, more people are aware of what kind of screenings they have to do. And even among the providers, there are certain areas of medical conditions where screening has really, gone up the scale, where the percentages of screening is really good. Lung cancer screening, though, only 10% of the patients who actually qualify for screening get the screening. Wow. So it's more education, more awareness, both among the patients, both among the providers that we have to do. Why is it important? Are you going to find lung cancer? Yes. And that might be a stigma. Okay, I don't want to do it because I might find something bad. But what does it do if you find something is you're not going to be a stage 4, but you're going to be a stage 1. Right. Where your survival rate is 80 to 90% compared to 20%.
And there are some cancers that don't have any noticeable symptoms for a while, correct?
Yeah. If you have a 1 centimeter spot on your lung, you're not going to have any symptoms. Yes, if you have a 4 centimeter, you're going to cough up blood, you're going to have breathing issues and stuff. So that the screening can catch that 1 centimeter, versus when you have symptoms, it's no more screening, it's because you are symptomatic. Right. Makes a huge difference.
Dr. G, what screenings would you recommend nobody skip?
Well, just see your primary care provider once a year. I would say even I'm not a pediatric physician, but even pediatric population or IC 18 and above, just see your primary care provider every year. You're not only screening for, age-appropriate cancers, we also do screen for high blood pressure, do those basic blood work, screening for diabetes or prediabetes or liver enzymes, suggesting fatty liver. And also during the screening process, we also encourage getting vaccines, which are also important in now day and age. One thing I want to add to Dr. Carter-Gadda is, I don't know if how many people know here, 2025 has seen a record number of cases, new cancer diagnosis throughout the world. US alone had more than 2 million. So that number can be a little confusing or hard to interpret. I'll just say, hey, in my primary care practice, on an average every year I may be having new diagnosis of cancer 3 to 5. Last year I had 19.
Wow.
19, and most of them are breast cancer, but a few lung, prostate, pancreatic, actually brain tumors. So the good thing is most of them, they were diagnosed quite early, and they got the treatment and they're doing good. This year, I already have 15.
Wow.
Today is August 13th. I already have 15 new cases. So the good thing is, yes, there is increased incidence of cancer for various reasons, but we are catching them early and treating them effectively. So the long-term outcomes are better.
And just taking those few minutes could just affect them profoundly in a positive way, potentially, right? Dr. Capel, screenings for mental health?
Absolutely, depression and anxiety. So the American Academy of Pediatrics has already implemented a routine screening when you take your child for a well-check exam. I think they start at age 8. We're seeing the early signs and symptoms of depression as early as 8 now. So the American Academy of Obstetrics and Gynecology has recommended that at antepartum stages as well, perinatal and antepartum stages, and the American Academy of Family Physicians, which is primary care. So a lot of these academies that dictate and regulate medicine and medical practices are starting to say we got to screen for depression and anxiety. Thank goodness it's now been recognized that when you have any kind of physical ailment, your prognosis is a lot lower if you kind of have a comorbid, untreated mental health condition like depression or anxiety, because when people are depressed, they don't take their medicines, right? They don't go to their doctor. They don't tell anybody about what's going on. So,
Dr. Nader, screenings in your field?
Yeah, orthopedics is a little bit different because we don't have a screening that everybody should get in ortho.
Right.
But I think one that is important is bone density, especially in that aging female population, people who have already had a fracture, because this is a silent disease. You don't really know the health of your bones without the screening. And like we talked all night, this is a really good way to prevent something worse.
Fantastic. What's the biggest misconception that you hear in your specialty? Dr. Nager, what is it?
Yeah, I love this question. So there's a couple in orthopedics, but the big one I would say is that, oh, I'm going to an orthopedic surgeon, I need surgery. That's not true. Most of what we do actually as orthopedic surgeons is non-operative, okay? We have a ton of modalities. We have physical therapy. We have anti-inflammatories. We have activity modification. We have bracing. We have all kinds of great things that are not surgery to get you back in the game, okay? So I think a lot of people are scared to go to an orthopedic surgeon because they don't want surgery. They're not good surgical candidates. We can still help you out. There's plenty more we can do other than surgery.
Awesome.
Yeah.
Dr. Cables, what's the biggest misconception that you run across?
well, I think there's two that I would like to mention. It's kind of one of them is if I tell somebody how badly I'm feeling, they're going to think I'm crazy.
Right.
Right? And the other one is they're going to put me in an inpatient facility and lock me up, you know? And the goal of mental health providers, any kind of family physician, any kind of internist, a primary care doctor, is to keep you out of the hospital, which is why all of this early and preventative is so necessary.
Dr. G?
Well, I feel fine. I don't need a primary care doctor. That's very common. Or I'm fine. I don't need to manage my prediabetes or high blood pressure. Yeah, most common.
Yeah.
So that's a really good point, because in orthopedics, a lot of people say, Doc, I don't want to exercise. I'm not overweight. You know, I'm in a good spot. Well, exercise is good for losing weight, but it has so many other benefits, you know, for your joints, for your muscles, for your strength, for your mobility. So you should still exercise even if you are at a good weight.
Two things I would like to mention. Okay, I've smoked all my life. I've smoked for 30 years. It's not going to make a difference if I quit now. It's never late to quit. Okay, and we already talked about what it does in 10 years, 15 years, 20 years. Second thing, okay, I've had my screening. I've had screening every single year for 4 years. Everything's good. I don't need a 5th year screening. So that's not true. Your screening test can be all normal for 5 consecutive years. You could still have something come back as positive on your 6th year. So screening is meant to be done periodically and not to skip because you feel fine.
Dr. Patel, some misconceptions you've run across?
I would echo what Dr. G said. You know, I feel fine, my heart's fine. The ultimate fact is that people don't start feeling fine until damage has already been done. And so many things can be prevented if people get their screenings and tackle the issues that drive the root cause of these diseases early on.
All right. So imagine a 50-year-old working adult, busy, stressed, sits most of the day, and has not seen a doctor in years. what concerns would each of you have, and what advice would you give that person?
I think probably the biggest thing is maybe what Dr. Caples brought up is why hasn't this person seen a doctor? What's keeping them from getting the care that they need? And a lot of times it is some of that stigma of being afraid of what they might find. But I think it's important to realize that what you might find is an easily treatable condition that's going to prevent a much bigger problem down the line.
And so, what would you tell someone to assuage some of those fears that they have? There's probably not a magic piece of advice you could give, but what would you tell them? Because that's a real issue in our country, is that people are just sometimes hesitant until it's too late.
Yeah. I mean, I think across all of our specialties, it's important for patients to understand we're here to help. We're not here to judge what problems they have or what decisions they've made before. We're here to help them move forward and live their healthiest lives.
Yeah. Dr. G?
Well, I see all the opportunities that were probably missed, where we could diagnose him of cancer or thyroid issues or diabetes, heart disease, and all the opportunities missed where we could tell him, hey, exercise, eat healthy, to prevent those conditions, or like vaccinations, everything.
Dr. Nager, what would you say to that person?
So in this situation, I'd be concerned about effectively wasting away, the muscles wasting, the bone wasting. The lack of activity is concerning. I'd say get after it, small, consistent changes like we talked about. And if you take care of your body's going to take care of you.
All right. Well, what's one thing you hope everyone leaves here and does differently tomorrow? If you could just isolate one thing that they'd leave here and do differently tomorrow, what would that be?
I'd say take time every day to think about your health, to see, to notice the small, subtle changes that your body is giving you clues about, and to actually act on those changes and your health. Take time for yourself. Yes, we're in a busy world, but take time for your health.
Dr. Caples, what would you say?
I like that. I love that. I would definitely add to that of not just taking time for yourself, but also take a little bit of time to focus on someone else too. Altruism is a really big risk factor in developing depression, which means you're giving to someone else.
Yeah, just serving in your community has major benefits. Yeah, I've discovered that with a lot of folks too. How about you?
So I would like to elaborate that a little bit, if you don't mind.
Sure.
So I want everyone to understand two terms, lifespan and health span. So lifespan is total number of years a person lives. Health span is the total number of years a person lives in good health, like free of like severe medical illnesses or chronic comorbidities or like functional or cognitive decline or disability. So just to understand, just imagine there are two 85-year-old people, one person has been active throughout the life, sleeping good, eating good, exercising, and until he was 83 or 84, and then he got sick and he passed away at 85. But there's another 85-year-old person who, starting at age 60 or 65, started having diabetes or complications from it, heart disease, maybe osteoporosis or hip fracture, now the patient, or renal failure on hemodialysis. They are suffering, they are debilitated, they are dependent on dialysis, so they don't have the freedom or the independence. So if I'm not going to live forever, or none of us, but my goal for myself and for my patients is to make sure you do something today, which will help with your current health goals, but also to support your future health and well-being.
Awesome. Dr. Nager?
One takeaway from me, I would say, is to be active and try to get a little bit healthier every day.
That's a good advice. All right. Well, that's all the time we have, and I really appreciate each one of you. I'd like to thank Dr. Nager, Dr. Gadragada, Dr. Caples, Dr. Gadraju, and Dr. Patel for joining us. Also, a huge thank you to Midland Health for entrusting Basin PBS with these very important discussions we've had tonight. We'd also like to thank the Elizabeth Yeager family and the Anwar family for their continued support of Basin PBS. I'd also like to thank the Basin PBS board, staff, and our amazing crew for tonight's program. Programs like this are made possible by viewers just like you. If you're not a member and you'd like to become one, we would love that. Please visit basinpbs.org for more information on memberships or to donate. I'm John Mesh, and on behalf of the Basin PBS family, thank you so very much for watching tonight.